High blood pressure, foods to avoid. High blood pressure can be best combated by avoiding certain foods and food products. This will enable the body to better manage the elevated blood pressure levels to bring it down to normal values. Just by avoiding certain foods, one can effectively lower blood pressure without medications. Here are some of the foods that an individual with high blood pressure should be limited to or completely avoided. Salt. The direct link between high salt intake and elevated blood pressure levels has been proven by many clinical studies. Patients with elevated blood pressure should restrict salt intake or, even better, totally avoid salt consumption. When the body accumulates too much salt, it tries to flush out the salt by retaining water. Retention of water in the body causes increase in blood volume, which adds stress to the blood vessels and heart, and thus increases the blood pressure. Cutting back on salt intake is the first recommendation by doctors and healthcare professionals in order to manage hypertension. Alcohol. Alcohol consumption should be completely restricted. Research has shown that alcohol consumption in people suffering from high blood pressure is unhealthy and leads to serious health complications such as stroke and even death. Alcohol is known to increase the blood pressure levels, which may cause severe damage to the walls of the arteries. This again leads to raise in blood pressure levels. Fat. Fat has numerous health implications, including increased blood pressure. Consumption of fats, especially saturated trans fats, are harmful for the heart and blood vessels. Fat increases the body weight of a person, which increases the stress on the heart, which in turn rises the blood pressure levels. High and prolonged fat consumption also leads to plaque formation, which blocks the blood vessels and constricts their size. This also influences the pressure at which blood flows through the blood vessels and raises the blood pressure. Processed and packaged foods. Avoid processed foods such as those containing hydrogenated oil, trans fats, etc. They are indirect sources of bad fats and high sodium food. Avoid fast foods, all canned or tinned foods, and salted snacks. Preservative-containing foods. Most of preservative-containing foods are also rich sources of salt and sodium. Studies show that consumption of high amount of preservative-containing foods such as jellies, pickles, sauces, increase the dietary salt consumption and cause hypertension. Frozen foods. Some frozen foods and meats may have salt that are used as preservatives to keep the shelf life of the product. Avoiding frozen foods considerably cuts back on salt intake. Most high-calorie foods. Foods such as sweets, cakes, simple carbohydrates, all fats are high in calories, which in turn increases the body weight and leads to obesity. Obesity and being overweight is one of the primary causative factors for high blood pressure.